This is Stigma, where we talk with leaders from many industries about how mental health and addiction have impacted their lives. Many people suffer silently from mental illness, addiction, depression, anxiety, and trauma. They never seek help because of stigma. In this podcast, host Stephen Hayes and his guests share their stories of recovery in order to encourage others to do the same. Here's Stephen.
Welcome back to another episode of the Stigma Podcast. I'm your host, Stephen Hayes, and today's guest is Megan Bell. She is the Chief Strategy and Science Officer at Headspace, where she leads a team focused on global corporate strategy, technology strategy, and new ventures, including Headspace's digital therapeutics subsidiary, Headspace Health. She also oversees medical and clinical affairs, behavioral science, and clinical research, and design research, including implementation of a human-centered design process in product and content development for Headspace. Prior to being there at Headspace, she was the Chief Science Officer and scientific founder at a digital mental health startup called Lantern, whose core IP has gone on to become part of Omada Health and Ginger and others. And as part of her really incredible pioneering digital health research over the years, she's developed and validated more than 20 digital health interventions. At the same time, Megan is an adjunct clinical assistant professor at Stanford. And this conversation is really insightful into building a business, the entrepreneurial mindset, investing in behavioral health startups, clinical validation, effectiveness, access, all the real key core terms and thoughts that we think about when we build in this space. So I'm really excited about this conversation, excited to share it with you. Without further ado, Megan, thank you so much for coming on the show and speaking with us.
My pleasure. Thanks so much for having me, Stephen.
So I wanted to have you start, if you wouldn't mind, with a little bit of bio background and maybe how you found your way into the behavioral health world, if you don't mind.
Absolutely. So I started in the behavioral health world as a family member and daughter of someone who experienced severe mental health issues chronically, then as someone who's recovered from my own mental health disorders that affected me in my youth, adolescence, and college. And so really, for me, I started as an advocate, as somebody who was determined to change the culture around mental health. And I also had a strong passion to focus on prevention because I really wanted to turn my own experience into something that was not this dark, heavy thing that I couldn't talk about, but I really wanted to turn it into force of change to help prevent other people from going through what I did. And so my focus has been on understanding how we develop evidence-based interventions across the entire spectrum of mental health, from health promotion and prevention through improving access to specialized care. And so I went to graduate school really to focus on learning how to design and evaluate evidence-based mental health prevention and treatment interventions. And I specifically went to graduate school looking to work with a real pioneer in this space, Bar Taylor, who was a professor at Stanford, because he had in the 80s already explored the use of technology in improving access to care. And so in 2004, I started working on building my first digital health intervention. I moved out of academia very reluctantly after developing a couple dozen different evidence-based mental health and behavioral health interventions because I really wasn't successful in improving access. And that was my whole motivation to begin with. I developed a lot of very effective interventions and nobody could access them outside of the context of a research study. Very few of the nonprofits in the mental health space had the capability of owning and delivering those interventions. And so I really saw creating a company as the only option. I felt like there needed to be a sustainable business model behind offering prevention and improving access to care through digital treatment, digitally delivered treatment. So I helped start a company, which was not at all where I thought I would end up, but it's been a really exciting adventure.
Was that Lantern, right?
That was Lantern. So in 2013, I helped start Lantern, which was We licensed some of the IP that my team had developed at Stanford and a couple of other universities. We had a great research collaboration group actually around the world, multiple labs all contributing to this body of work that Lantern built off of. So Lantern at the time was really one of the first coached mental health apps. And I worked there for several years and then ended up joining Headspace, where I am now.
And so, what's your role at Headspace? From what I've read, it sounds like you're responsible for quite a few things there. So, you're chief science officer. I know you're responsible for digital therapeutic work going on. So, how do you sort of divide your time, and what falls to you on the Headspace platform?
It's a great question. My role, I've been at Headspace almost 4 years, so it has evolved. I've worn many hats, as you get to do at our point, kind of we're graduating from our startup status. But I started just as chief science officer. Then I took over our enterprise business, selling to companies and making Headspace available to patients through partnerships with health systems, IDNs, making Headspace available to members of health insurance plans through those partnerships and reimbursement work. And then I helped start our digital therapeutics subsidiary, which is called Headspace Health. And so my role today, I oversee strategy for the entire company. That includes corporate strategy, technology strategy, and then I oversee our Headspace Health, which is our digital therapeutics subsidiary, and science, which includes behavioral science as well as research. That's really focused on partnering with outside academic researchers to both help inform our development of new offerings within Headspace as well as evaluate what we've made.
So there's two concepts you brought up that I want to kind of dig into, and I think they need to be addressed kind of separately to keep them straight in our minds. So when we talk about new solutions, delivering effective interventions to the market, there's two things that came up for me in what you said. One is evidence-based, and two is sustainable business model. And I think how we find our way to where those two things overlap each other, I think that's where we are today in this industry. So I wanted to ask you about each of them. I kind of want to start with, why is evidence-based such a big deal? And I kind of want to start from the perspective of, we haven't measured mental health the same way we've measured physical health as a species over thousands of years. How do we go from there to evidence-based care, and what's it going to take?
Well, one, I think it requires a commitment to the importance of being evidence-based by all key stakeholders within a company. It also requires that commitment across all stakeholders in the industry. And so what I mean there is anybody who is in a role of, I think of it as being a gatekeeper of access to digital behavioral health tools. If you are making a decision about the evaluation parameters of partners, if you're looking at solutions to bring to the population that you serve, whether it's your employees, whether it's patients, whether it's members of your health plan, evidence needs to be important, both internal to the company as well as externally in our industry. It really won't work. And I've seen this tension of when our customers aren't asking for evidence or don't care about it, we're kind of doing it for our own sake. And so we really need to link arms as, developers of these innovations and the key access partners and stakeholders. And I think what it comes down to for me is the problem that we're solving is access. There are already evidence-based interventions that have been thoroughly researched. And so while we certainly could have a goal of improving on those interventions, let's start with what already works. I think we need to prioritize the problems that we're trying to solve in digital health. And so personally, I put access as the first one, but it's with the caveat of access to evidence-based solutions that are appropriate for, the problems that you're trying to solve for your end users. And evidence is important when we think about how we move towards more of a values-based model in healthcare generally. We really, I think from a moral imperative, you want to solve real problems for your members, which means that your solution, you should be able to demonstrate the efficacy and effectiveness of your solution for actually solving those problems. You should be able to do that internally. You should be able to do that, through more independent and objective external research on your offering. And you should be able to do that with every implementation of your offering. So if you are bringing, if we're bringing a solution like Headspace into a company, we should be able to tell that Headspace is actually making an impact on the employees of that company.
How do you do that? I mean, what does Headspace measure to determine effectiveness?
For Headspace, the primary problem that we're solving in a workplace is typically around resilience to stress and reduction of stress. We are best described as being on the health promotion side of mental health. We are more of what you might consider kind of an upstream offering. I think upstream can get confusing because health promotion is actually relevant across the entire mental health continuum. But for us, typically employers have realized that stress is a problem for their employees, that it is complex, it's interconnected with how people are sleeping, with their ability to focus at work, with how they interact with their team. And so, Headspace has impacts on a lot of different dimensions beyond stress. But I'd say that's probably the one that our partners are most interested in kind of leveraging us to help address. And we can address that both if somebody is stressed, we hold ourselves accountable to moving them, reducing the severity of stress, as well as helping buffer them from the effects of stress. And so that's really what we call, resilience, which is your ability to recover from challenges. And so there is great evidence that mindfulness-based interventions can improve resilience and reduce stress. We've also done the work to demonstrate that in about a dozen different externally led studies about Headspace. But then we also measure it for our partners. We do outcomes assessments around stress because it is kind of what you could consider our primary outcome today.
And you talked about access, and I agree with you. And I think it also talked about this concept of sustainable business model. And I think that might be where the crux of the problem in the innovation and the startup world around behavioral health is, yes, increase access, but we have to do it with sustainable businesses that can stay in business while they provide access. How do you think about that? How do you think about providing access, but doing it in a sustainable way? And how have we evolved as an industry, maybe in the last 10 or 15 years, to be able to build business models that actually can be sustainable, if that makes sense? So you saw Lantern, you've seen a lot in this space. So I'd love to get your perspective on how our models have evolved to provide access in a sustainable way.
Well, it's such an important question, and I think it has changed a lot. And I certainly can, with a lot of humility, say I've learned the hard way. When we started Lantern, and I was talking to companies about, whether they wanted to offer a CBT-based intervention for anxiety, depression, stress management for their employees, so many employers with whom I spoke, they hadn't made a commitment that addressing the mental health of their employees was something that they needed to do beyond offer, it through their health plan. And so while we believed there was a need, I think what we didn't thoroughly understand out of the gate was who is going to pay for this and why. And we, I think, spent years educating our market and our customers about the need for them to address mental health. And we're reaping those rewards now. I think now a company that is selling a mental health offering to an employer, there's a much better product market fit. Your customers actually want to buy that. They share your perception that it's a need. And so frankly, I think we were a bit early with Lantern. And so that's, I think, the other challenge with something like a solution that is targeting the enterprise or is targeting a health plan and needs to go through a pretty long and complicated reimbursement process is that you typically, as a startup, don't have the runway to sustain you through that journey. And so I think that is something that's been really interesting about being at Headspace, because we've built our enterprise and healthcare offerings on the foundation of our consumer business, which has given us a lot of stability and funding to invest in things that take a lot more time. And so I think the challenge for us as innovators is when we're trying to solve a problem that our market hasn't quite awakened to. I think it's a challenge to figure out how, as an early stage company, you kind of meet your customers where they are and how you sustain yourself in the moment so that you can make those bigger changes longer term. And I think that's one learning I can share from my Lantern experiences. We kind of went for all of it out of the gate. We tried to introduce a pretty dramatic change to how companies, health systems, health plans were thinking about their role in mental health and increase their level of comfort in offering a digital intervention as part of that. So there's a lot of work for one company to do.
Which is evidence to me, but I mean, Lantern's IP exists now inside of, I think, at least Omada and Ginger and probably a few others. So what you built is still alive. It is still helping people, and it's part of several platforms that are out there helping people now. Am I understanding that right?
You are, yeah. It's in it that actually were 6 licenses. So it's in several companies, and it is really encouraging to see it live on, which is always the goal. I think, for entrepreneurs who are listening, the challenge is like, how disruptive do you want to be out of the gate is more of my kind of message is, how many new things do you want to try to introduce to the market at once? And how might you phase your innovation so that you actually can stay in business and keep it going long term?
And I think that's what's interesting to me is how Headspace has kind of gone about this. That started out as a direct-to-consumer meditation app and built a sustainable business on that, and now is moving into digital therapeutics. And can I say that Headspace probably evolves into a care provider at one point? Is that a stretch to say that?
Well, I think, if you're venturing into digital therapeutics, you're either going to be a care provider or, be submitting 510(k) and going through an FDA regulatory process. So, yeah, I think that is safe to say that we'll be headed in one of those directions because those are the paradigms that we need to operate within.
I see this shift in healthcare broadly where somebody's delivering a specific solution to a specific population, whether it's meditation, or maybe a better example today is diabetes treatment at Livongo, or maybe it's women's health. We're seeing a lot of startups get a lot of traction and providing women's health solutions. And then once they provide that and they build that user base, they start to sell other services to that loyal customer base. So you provide a service, you build a customer acquisition funnel, you provide that service profitably, and then you start to sell other high margin, high value services. That seems to be the model that works in this space. And it seems to be the path that Headspace and others are on. And I wanted to kind of get your reaction to me describing it that way and get some advice from you for entrepreneurs that are sitting there, thinking, I've got an idea. I'd like to bring this to life. I really want to help people. Where do I go? What do I do? And I love the comment you made about how disruptive do you want to be out of the gate. I think a lot of times entrepreneurs just maybe might bite off a little more than they can chew right at first.
I think they do. And I certainly relate to that. There's one of the things that drives us as entrepreneurs is our intolerance of the status quo and the urgency of change that we feel needs to happen. And that is your superpower that will let you be resilient through the working 24/7 ups and downs of life as an entrepreneur. However, I think if you get really crisp who you're trying to design something for, what their needs are, and how you step into that in a way that lets you do something really well that benefits a maybe more focused group of users. But I think you have to hold this dialectic. And I'm imagining myself as I had this visual I would draw on the whiteboard at Lantern, and I've used it at Headspace, of these concentric circles of who are we, designing for today, And let's just put on the whiteboard all of those other concentric circles of people that we want to help around this. But we need to get it right for a small group and a focus group, and actually demonstrate that someone's willing to pay for this so that we can keep designing for benefits, beyond. And so that small population might be people who are stressed at work, or children who are, have experienced a trauma and don't know where to go for help and don't feel like talking to a grown up about it. It might be, an older adult who's lonely and is, covered by Medicaid or Medicare Advantage. But you should think about who is really define the end user, and also think about why they're going to pay for it or who's going to pay for it for them, and be really clear what the requirements are for that to happen. Because I think this is where I think as an industry, it's getting easier, but it is still complex to understand the requirements of reimbursement by a third party. So if you are designing something, but you're designing an offering that's still too expensive for a consumer or the consumer that you really want to help, I think you need to ground yourself in the reality of how can you fit what you're doing into an existing reimbursement model. And you can see that many of the companies who have done that, like Ginger, have been able to actually provide care and sustain themselves because they're not trying to change the payment paradigm. They're trying to kind of insert the services that they're providing into a model that already exists.
Yeah, it's interesting. When you talk about design in this space, it makes me think about the team that's doing the work. And I think in this space, we get a lot of teams, some different team makeups, right? So we have teams that are clinicians, we have teams that are tech founders, and sometimes we have teams that have clinical and tech background. How do those different constituents who are interested in building in this space come together to design for the right person in the right way and figure out how to get paid for it? Is there a secret sauce there? Because I feel like that's where a lot of startups in this space get hung up. They're not focused enough early.
I think that they need to invent a new way of working together. And it starts with learning how to speak the same language. Because if you're designing in mental health or digital health in general, frankly, you need to have that clinical expertise at the table while you're making business and technology decisions. And so I really think of it as, there's this three-legged stool. You need all of those, different perspectives to weigh in on lots of different decisions that you're making. So one, I'd say you need to have a strong clinical or scientific leader who is fully empowered to be part of your senior leadership team of any company in this space. I think that that's improved a lot over the last 5 years. It wasn't the case 5 to 7 years ago. The next thing is, I think often, and I see this when I bring in people who are new to industry, but they've worked in academia or they've worked in clinical settings, they don't realize how much they have in common with the product manager, with the engineers. And so there's this navigation of learning how we find this common ground and common language. And, one of the things that I've seen work best to bring people together is have them actually work side by side, listening to members. I use the word member because that's what we use at Headspace, but go out and talk to your target users, understand their problems. When I've seen teams, these cross-functional teams, go through a really true human-centered design process that involves an investment in this research phase, and what I mean there is design research phase, they end up developing the same kind of view of the member need and appreciation for this balance of evidence, of clinical judgment, and of a product that is easy and enjoyable to use and is reimbursable, because they've all been exposed to the same information. So I think that's one thing, is it actually comes down to how you have your teams work together, because that, in my experience, when I've seen teams go through those kind of projects, one, they're extremely cohesive as a team, but they also really know how to flex their different superpowers in a way that is going to help them get to a solution that is, one, desirable for the end user, but also kind of meets these other requirements.
Yeah, that's fascinating. I think team dynamic in this space is really important to try to figure out. Another thing that's important to figure out in this space is where that white space is today that is achievable. And what I mean by that is kind of what you said. It's we can design something that people want and that they need, and we can also get paid for it. And so I wanted to ask you, as somebody who's built in this space and continues to innovate in this space, if you could build anything, if you weren't constrained by capital or where you work or anything at all, what would be the thing that you would build to help people with their mental health if you could build anything at all?
I love the question of what I could build without any constraints. So I would build an approachable front door for mental health, because if you have ever had the experience of trying to find help when you actually need it, it is totally bewildering. And I get emails daily from people in my own social network asking how they find help for a loved one. And so I really feel like we need to think about how we meet people when they are in these moments of need and recognize their humanity, see their suffering, and help them navigate to the resources that they need, ideally, which are evidence-based. And so I actually come back to this kind of navigation, but navigation with empathy, because I think that's often what's missing. When you call to find out if somebody has availability, people aren't returning your phone calls, they don't take your insurance. It's really discouraging to try to find help. And frankly, it's really hard to find good help after a psychiatric hospitalization. And so I think there are a couple really important moments. I personally think we need change across every aspect of our mental health care system, but there are a couple of places that personally kind of give me the shivers just from my own personal experiences trying to navigate them for loved ones. And one is when we hospitalize people for an acute episode of a mental health problem, we say we're doing it to stabilize them. It's not real stabilization. If you look at the data on the number of completed suicides after, 12 days after hospitalization, it's extremely alarming. We're not actually meeting those needs. And it's really hard to find somebody to see you once you have been discharged or, had suicidal ideation. So that's a place where I don't hear about that at all in our industry. And I think it's a urgent problem to solve. The other is children. I think, right now this child mental health crisis that we are living through right now and just starting to see the data emerge on is like nothing we've ever seen before and will impact this generation for the rest of their lives. So I want to see a lot more attention on youth mental health and specifically school-age children and high school and college age young adults.
Yeah, and I think in that population and also in the adult population, when you talk about an approachable front door, it's not just for the people that are in need of acute care, because there are a lot of people who are going to need care and they're sliding towards a place where they will need it. And I was kind of hoping that we build solutions that would encourage those people to do something about their mental health before it becomes an acute care problem and never have to go to the acute care location. For me, that was rehab. I crash landed into rehab and it saved my life. And I was there for a couple months. And when I was leaving, they did a great job of helping me find my footing in the outside world, is what we would have called it while we were there, with an AA group and a psychiatrist and a therapist. And I mean, when I got off the plane from rehab coming home, I had a map. I had a roadmap. Go here, do these things, talk to these people, and I did it. And it allowed me to transition back into, I guess I'd call it real life. I mean, it took a long time. It took a lot of work. So the rehab center did a good job, but I agree. I think it's really hard for people to find help when they're being discharged, especially from your typical 3-day psychiatric hospital stay. Because the benefit I had in rehab was I had several weeks towards the end of my stay to try to figure out my plan. But I'm also interested in, how do we get people to not have to go to acute care? How do we get them to enter into mental health care? How do we get them to engage with their mental health? How do we get them to never need to go to rehab or never need to go to an acute psychiatric hospital? I feel like Headspace is really well positioned to do that. You guys have created a UX UI that's enticing to people, and now it's just a matter of getting people to use it.
Absolutely. And I really couldn't agree more, Stephen. This is one of the things that gives me the most energy, is thinking about how we prevent suffering in the first place. And I think about it as, one, we need to change the culture so that when we think about mental health, we're not only thinking about it in the context of a mental health disorder, we're also thinking about it in the context of mental well-being, meaning I should be thinking about my mental health while I'm healthy, not when I start to experience symptoms of a mental health disorder or I'm diagnosed with a mental health condition. And so I think, one, we need to talk about mental health more. We are starting to do that. And it's one of the, we're seeing the prevalence of mental health disorders rise because of this pandemic and, the interrelated crises around it. But we're also shining more of a spotlight on it and learning how to talk about it with people in our own lives. So I think we need to learn this language that lets us talk about mental health. We also need to make sure that when we do that, we are broadening the definition to be more holistic in how we think about it. And I think then we also need to ensure that everyone who wants to engage in a mental health promotion or prevention intervention has access to it. And so while we're, really trying hard to find ways of increasing access to Headspace, as an example, we have very significant social impact commitment to make Headspace free for teachers in K through 12 education. We've made it free for the unemployed at different periods throughout COVID-19 crisis and unemployment crisis. We've made it free for healthcare professionals, but we can't make it free for everyone. And so that's why, we have doubled down on trying to provide it through employers, as well as are working on coverage and reimbursement by health insurers. But we need those partners to care about providing access to preventative interventions, because it's a balance of create them, make them engaging. And, I always think about it's a balance of engagement and efficacy. You can't have one without the other. But we really need those key gatekeepers of access to be thinking about their responsibility in providing access to interventions really across this whole continuum.
Yeah, that's really well said. And, I know we don't have a ton of time. So one of the things I like to wrap up with is, especially when I'm talking to someone who knows far more than I do about this subject matter. I mean, look, my only qualification is that I'm an addict living in recovery with bipolar disorder. I don't have any education, any clinical education. I've never treated anybody. I sponsored a couple of guys in AA, but that's about it. What questions should I be asking? What should I have brought up about, whether it's about Headspace or whether it's about innovation in this space? What's the right question to be asking broadly?
One question that I don't hear enough is about ethics in this space. And, the laws that govern the practice of psychology. I'm a, clinical psychologist by training. They're there to protect consumer safety. And, as psychologists have an ethical code that we opt into following in addition to those laws. And one of the things that I have seen in this space is, I guess you could call it like the weaponization of disruption. It's like disruption is wielded like a weapon in terms of you can disrupt anything because your goals are noble. And I think and I've written about this before, I think we need to be careful what we are disrupting in digital health and in mental health care specifically, because you don't want to disrupt your ability to understand who is a mandated child abuse reporter and what you do when you find out about that or have access to that information. There are some really important ethical cornerstones of the practice of psychology and treatment of mental health conditions that we need to still follow. And frankly, that we need to improve on our ability to really execute. And so I often find myself thinking about these concepts of informed consent, of risk management, and quality assurance. Meaning, are we thinking about quality for everyone that tried to use our offering or everyone who just successfully used it? And so, in digital health research, we think about negative effects as being, you need to look at what's happening for people who stopped using your product, as well as for people who kept going with it. So I think we need to have more conversations about the ethical side of the practice of digital behavioral health as well.
Well, that brings up another question I do want to follow up with, around, if you don't mind, around, as an investor, what's my role in that? What's my role in making sure I'm not funding things they're going to hurt people as opposed to help people?
I think it's such a great question to ask. And I would say, as part of your diligence process, to make sure that you have an expert that you can engage to actually guide you through that, to help you develop your protocol around, what information and documentation should you be requesting from the companies that you're thinking about funding. They should be able to operationalize and describe in writing what they are doing in their product development process, what they're doing for ongoing quality assurance and risk management. They should demonstrate an understanding of relevant ethical codes, state and country level kind of legal frameworks. Frankly, they need to understand where they fall in a regulatory context, and which is always evolving. And so I think you're best served by having your diligence practices actually be informed by experts in those respective areas, because you are a gatekeeper too. What you fund will, go out into the world for better or worse.
Yeah, we have a team of advisors. A lot of them are clinicians and researchers and folks in the space. And then I have a guiding principle that I use, which is I try not to invest in it if I don't think it would have worked for me in my own recovery or worked for one of the people that I'm sponsoring or helping or working with in their recovery, which actually still is a pretty broad set of solutions we can invest in. But if I don't see it working for something that I understand, then I try to shy away from it. And it doesn't mean that it won't work. It's just I don't find myself experienced or smart enough to be able to validate it or decide if it's going to help or hurt people. So that's kind of my guiding rule of thumb. Not very scientific, but it's a starting point.
It's a great one. I actually have that for myself, which is build with integrity. I should only build something that I'd actually want, my mom to use, my dad to use, my son.
Yeah. I would probably never invest in something that if a new guy walked into an AA room and said, "Hey, help me," I probably wouldn't invest in it if it's not something that I'd point them to as a supplementary solution for their recovery journey. So that's really my filter number one.
It is. The other thing I'd say there, Stephen, is, and it doesn't need to be the only thing that they need to do.
No, of course not. There's a continuum of care. I mean, even when I sponsor somebody, I don't think AA is the only answer. I mean, for me, I go to church, I go to AA, I see a therapist, I have a psychiatrist, I take medication. I have a whole continuum of care around me. Everybody needs a continuum of care around them, specifically for mental health. I mean, you think about our physical health. We have gym memberships and we have primary care physicians and we do all kinds of stuff for our physical health. We should be doing the same here.
I couldn't agree more. And I do think that we need to calibrate our expectations of these companies to what their stated purpose is and what their role is within that. Right now, like Headspace as an example, we're mental health promotion. We're in the preventative side. And so expecting us to be an appropriate treatment for an anxiety disorder, that's not what we say we do. It's inappropriate, but we still could help somebody who's getting a treatment for an anxiety disorder. We could be part of their care, of that, collection of things that they're doing. And so I think that, that calibration of understanding what role this has to play as part of this more multi-pronged approach is important.
Yeah, I think of it as a landscape like under a bell curve. And on the far right of the curve, and this third standard deviation to the right, is wellness and performance. And as you get like the median line down the middle of the page is on the left of it is people who are reactive to their mental health, and on the right are people who are proactive. I think of Headspace being in a place where most of the users are probably proactive and somewhat well. I think of Headspace as not existing so much on the left side of the chart in the reactive world, where Headspace wasn't going to prevent me from going to rehab after I crossed a certain point in my life experience. It was going to require a more acute solution. So I think of the far left side of that normal distribution is people who are sick, people who have mental illness, or they have a severe mental health difference. There's a lot of unmanageability in their life because of their thing they're struggling with, whether it's jail or arrest or losing a job or going to rehab or overdosing or some sort of psychosis. So I think about it. Yeah, I think about it in terms of a landscape of, sort of severity or acuity. And I think Headspace is a tool that will eventually, I think Headspace evolves to treat people on more of the high acuity side eventually in the future. I mean, it has to as the digital therapeutics evolve.
There's certainly a great need there.
Oh, there's no doubt about it. Look, this has been really enlightening and helpful and educational. And this is just one of those conversations that honestly, it helps me get better as an investor. And I'm just really glad we got to record it and I get to share it with people. So I'm really thankful that you carved out time to do this with us.
Well, thanks so much for having me, Stephen.
Thank you again, Megan, for being here on the show with us today. I think a lot of the entrepreneurs and the aspiring entrepreneurs in the behavioral health space will find this very helpful. To our listeners, thank you for being here. And please, if you like our content, please hook us up with a subscribe or a like or a review on your podcast platform of choice. We'd love for you to share us with a friend. If you'd like to support us in the content we create, then you can find us on Patreon. On our Patreon page, we provide additional insights, thought pieces, research, public company analysis, and it's all there for our loyal supporters. I'll link to that in the show notes. To the founders out there, don't forget to join the Mental Health Startup Slack community, which you can also find a link to in the show notes. And we have 2 new initiatives that we're working on. One is a new segment on the podcast called the Founder Spotlight, which will be an episode that consists of 5 3-minute pitches from founders in the mental health space. There's nothing filtered, nothing edited. And we want to leverage our platform to bring more awareness to more founders. So look for a link to sign up for that in the show notes. And the other thing we've started recently at What If Ventures is the What If Fellowship, which is a program designed to help facilitate increased company building within the mental health space. And we're really aiming to help mental health startup founders accelerate the process of going from an idea to a plan to execution and funding. You can learn more through the fellowship tab on the What If Ventures website or via a link in the show notes. And finally, we want to hear from you. Please do comment on social media. Let us know what you liked or what you want to hear more of or what you disagreed with. You can reach out to us on Twitter at StigmaCast, on Instagram at StigmaPodcast. You can email us, info@stigmapodcast.com. And you can obviously find us on our website at stigmapodcast.com as well. Thank you for being here. And until next time, stay safe, be well, and thank you for your support.